How are you doing today? I assume you're my cranial. Alright, fantastic, yeah. Okay, I'm going to pop your gloves on and we'll get started straight away because I don't want to keep you any longer than necessary. Alright, I hope you're doing well. I am Dr. Sean and I'll be doing your cranial nerve today. Okay. So I'll explain each step as we get to it. Okay, so you'll be fully aware of what is coming up, what we're going to be doing at each stage. Alright, just keep you nice and relaxed. Alright, it's going to be hopefully a relaxing experience for you. Nothing difficult for most people, I would say. I'm sure you can blast through all the tests with relative ease. Alright, so to begin then I want to have a look in your mouth. Is that alright? Okay, you can just open your mouth for me and say ah, ah. Keep saying ah. Okay, wonderful. And close your mouth for a moment. Just write a few notes, so nothing wrong or anything. Okay, I'm just going to write sterner findings, so nothing unusual. That's good. Okay, if you could stick your tongue out for me as best you can. Yep, that's wonderful. Just keep it. There we go. Okay, if you lift your tongue up to the roof of your mouth for me and keep it there for a moment. Okay, that's really good. Now I want you to put your tongue into your cheek, press against your cheek, and I want you to press against my hand. Okay, so I'm going to be placing my hand on your cheek, if that's alright. Okay, and then I want you to press your tongue into your cheek and then into my hand that's resting on your cheek. Does that make sense? Okay. Okay, we'll start with your left side. Okay, so into your left cheek, press, 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 and relax. Well done. And the same again on your right side. Okay, so if you can press your tongue into the right side, or your right cheek, I should say. Yep, and against my hand again. So press, 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 press. Okay, that's wonderful. And relax. Okay, I think that's it for the tongue aerobics today. Okay, the accessory nerve test now involves quite simply, I want you to shrug your shoulders and keep them there. Okay, when you do this, I'm going to be trying to press your shoulders downwards. Okay, so I'm going to be trying to exert a force downwards, and I want you to try and resist. So if you can keep them up by your ears as best you can. Alright, so shrug your shoulders for me. I'm going to place my hands on your shoulders. I'm going to press down in 3, 2, 1, resist, resist, resist. And there we go, well done. Good, set strong on the shoulders. Well done. Okay, so no problems there, that's fantastic. Okay, a quick mouth check, but nothing to do with the tongue. So if you open your mouth as wide as you can without it causing you any sort of discomfort or anything like that, there we go. Just going to have a look at the back of the mouth as best I can. Okay, that's great, wonderful. Okay, and now I want you to swallow for me in your own time, so you can swallow. Okay, that's wonderful, yeah, that's fine. Alright, well done. Good. Okay, so I'm going to be whispering two numbers and a letter into each ear. Okay, so I'm going to be coming over here, I'm going to be whispering into one ear, then I'll look at you. When I look at you, I want you to repeat the whispered two numbers and one letter. Alright. Okay, here we go then. 2, 3, L. Well done. Other side. 5, 7, P. Okay, we'll do one more time on each side, okay. 9, 7, C. Well done. And finally, 8, 1, Q. Fantastic, yep, absolutely no issues there. Okay, so well done, that's phenomenal. Okay, Okay, we're going to do the Renee and Weber tests. Okay, so we're going to be using a tuning fork for that. So the first test, I'm going to be placing a tuning fork on the centre of your forehead, believe it or not, so straight. Yeah, on there, and I'll be hitting the tuning fork, not your head, okay, not your head. And then I want you to tell me, does it sound more or less the same on the left side and then your right side? It doesn't matter if it's a little bit different, that's perfectly fine, okay? We're looking for massive discrepancy between one side versus the other, alright? So, so that's promised on your forehead. Okay, right there. Here we go. So does it sound the same on both sides? Is what I'm going to be asking you in a moment. Okay. For now, just have a nice listen to the tuning fork sound. Okay. Here we go. Okay. So did it sound more or less the same through one ear and the other? Or was it louder one side? About the same. Okay, we'll do that again just to be thorough, okay? So yeah, on the forehead, sorry if it's a little bit cold, alright? I should probably warm it up, shouldn't I? Okay. Should be a little bit better. There we go. Oh, excuse me. There we go. Same again, okay? So have a good listen first of all. Okay, did it roughly sound the same on both sides? Okay, that's fantastic. Okay, so that's the Weber test. We're going to do a Renee test now. So what I'm going to be doing is I'm going to be placing the tuning fork this time behind the ear. So we have a little bone that sticks out behind our ears, which you can feel if you just press behind your ear. Yeah, so I'm going to be placing it on that portion of the head, okay? And I'm going to be hitting the tuning fork as before. So, and after a while, I'm going to be stopping the sound, okay? What I want from you is to tell me when the sound stops, okay? So we're not interested in when it starts, but we're just interested in when it stops, alright? I'll take my gloves off just to make it a little bit more difficult. Because we want to try and, you know, keep you on your toes, give you a really good test. Alright, so I'm going to start with the left side, and we do the right, then we do left again, right again. I'm very thorough. You're worth it. You are worth it, right? I think you're worth it. Okay, on the ear, on the mastoid bone as we call it, so tell me when the sound stops. Okay, here we go. Okay, hold on. Again, tell me when the sound stops, please. Here we go. Good. Next one. Good, tell when it stops. A bit trickier that one. You did well. Okay, final time. Here we go. Tell me when it stops again. Okay. Hold on. Okay, so that's fantastic. So no issues there. Okay. So I'm very pleased with how that went. So really well done. How are you finding it so far? It's not too bad. A lot of patients find it very relaxing. Some actually nod off. Yeah, a bit rude really, but what can you do? That's fine. If you want to fall asleep, you can. But don't be surprised if I wake you up, okay? Okay, so get these gloves on. Okay, it's not going very well. It will do for now. Alright, if you don't, then we'll move on to the very next step. Okay. Right, so that's fine, the VR180 test. Right, we're going to be doing what we call the facial expressions, okay? Yeah, so this is quite a fun thing. This is testing the facial nerve, okay? So this is cranial nerve number 7. Got a range of tasks here for you to perform. Okay, they're pretty simple. So for example, raising your eyebrows, things like that, puffing your cheeks out, that sort of deal. Yeah. This is fun part for me. So I get to see people pull pretty silly faces in the name of medical experimentation and assessment. Yes. Okay, so I'm basically looking for symmetry between your left and your right. Okay, so I'm not looking for, I mean, like, so if one eyebrow is slightly, more up than the other one, then there could be something underlying there. Okay, so it doesn't matter if you've got a slightly asymmetric face or anything like that. That's not. It's more or less the the levels of like the eyebrows and stuff like that. The cheeks, if one cheek's puffed down, the other one's not. Things like that. All right. So we're going to start with the raising on the eyebrows. If you can raise your eyebrows for me and keep them there for me. That's good. Keep them there. Good. Keep them there. Okay, really well done. Relax. That's good. Okay, I'll be asking you to close your eyes in a moment. And I'm going to be trying to open them because I am a very naughty doctor like that. Okay, so I'll try not to poke you in the eye. It's happened a few times, I'm not going to lie. But in my defence, they were moving about quite a bit, so if you keep reasonably still, I shouldn't be poking you in the eye. Okay, it'll be your fault, not mine. Okay, so close your eyes for me. I'm going to be trying to open them, so keep them closed. Resist me opening your eyes. Resist, 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 resist. And there we go. Open your eyes and relax. Well done. Okay, really well done. Good. Okay, so that's fine. No issues there. Now I'm going to be asking you to puff out your cheeks. Yep, your best pufferfish impression. Yes. And I want you to resist me pressing them in, okay? So we don't want that sound, alright? Okay, just give me a minute. Okay. Now, puff out your cheeks for me. I'll try not to laugh. Okay, yep, that's it. And I'm going to be pressing them in. Don't let me press them in. Okay, here we go. Resist, resist, resist. Get it puffed out. And relax. Yeah. Well done. That was good. Yeah, sometimes you get a blast of breath when you do that, so yeah. Not always nice breath either. Alright, no issues there, that's fine. If you could purse your lips for me as if you were applying lipstick. I know you don't always have to do that to apply lipstick, I understand that. I have been educated. But yeah, just sort of, if you could do that sort of, like that, hold it there for me. So just keep holding that wonderful pose. You're looking amazing, by the way. Fantastic. Well done. Relax. Good. If you give me a big teethy grins, I want to see your wonderful teeth, which I'm sure are much straighter than mine. Keep it there. Keep it there. And that's fantastic. Thank you. And relax. Okay. Good. Okay, have you noticed any changes in taste recently? I mean, your taste buds, not your taste of film, fashion, or anything like that. Okay. Have you noticed that your hearing sounds worse lately? Okay, and does it sound louder than normal lately? Okay. So I'm going to be quickly physically inspecting the ears, that is to say, I'm going to be touching and prodding and poking and pulling at your ears. Is that okay? Thank you. Okay, so yeah, just look forward for me, that's wonderful. There we go. Give a little inspection of the ears then. Okay, I can't see anything obvious, so that's always a good sign. Okay. Alright, now I need you to let me know if there's any pain or discomfort. Okay, I'm going to be doing several tasks here. First of all, I'm going to be squeezing your earlobe, okay? Any pain? Okay, I'm going to be folding over the top of your ear. Let me know if there's any pain. Okay. Okay, I'm just going to be pinching the middle portion of the ear. Again, I want you to tell me if there's any discomfort or pain. You will feel a pinching sensation. That's perfectly fine. What we want to know though is there any excessive pain at all. I'm going to be very gentle with the pinching, so don't worry. I'm not going to hurt you, okay? Okay. So let me know if there's any excess pain. How's that? Nice and gentle. Okay, fantastic. When you look on the other side, naturally, because you do have two ears. Okay, excuse my shoulder cracking. Alright, so again, nothing obvious I can see on the right ear. Okay, good to me, that's fine. Again, then I'm going to be squeezing on your lobe, or lobule we call it. Okay, do let me know if there's any pain. Does that feel okay? Okay, so next thing is to fold over the ear. Yep. Any pain? Okay, and the third and final thing, can you remember what it was? Pinching, yes. Okay, so let me know if there's any excessive pain. Okay, so I'm going to be gently pinching the middle portion. There. Is that okay? Okay. Yeah, when I hear ow, then I know, yeah, something's up. Yeah, I've been slapped once by one of the patients. It happens. Okay, so that's fine. Physical inspection of the ears is fine. Okay, so we're going to move on to the muscle bulk facial muscles sort of test. Alright, so it's quite simple really. I'm just going to be asking you to clench your jaw in a moment. Okay, if you're not sure what clenching means, I just mean bite down with both your teeth. So your top teeth sitting on the bottom teeth with a little bit of force, but obviously I don't want you to be hurt or anything like that, so only do it so as far as you can that it's comfortable. Alright, so to start with, I'm just going to be feeling the temporal region on the side of your head. Okay, here we go. Just keep your mouth relaxed, sorry I should have said, yeah. I do like to confuse my patients at times. Okay, if you can gently clench your jaw for me. Okay, and relax your jaw. Okay, if you feel underneath the jaw, that's all. Be gentle, okay, don't worry. Okay. Okay, if you can clench your jaw again for me. Okay. And relax. Alright, that's fine. Yeah, just going to make another note or two here. Okay, you're doing really well. How are you feeling? Okay. Okay, we're going to be testing your jaw reflex in a moment, but first of all I want you to open your jaw. Okay, I'm going to be exerting a force to try and close the jaw. I want you to try and keep it open as best you can. Again, I'll be very gentle, so it'll be a very gentle, subtle force. Okay, so just act upon it, and again, I'll be very gentle, so there won't be no massive, Alright, so keep your mouth open for me, quite wide, without it becoming uncomfortable. Okay, and then just resist me trying to close your jaw. Okay, here we go. Resist, resist, resist. There we go. See, I was nice and gentle there. I did say, didn't I? Alright, we're going to be doing your jaw reflex in a moment, okay? So, that's fine. So we do have this very big, scary reflex hammer. Don't be alarmed, okay? This does raise some eyebrows when I pull it out. I think people are quite impressed with the size. Okay. So, I know what you're thinking. Yes. Right, so what we're going to do then, I did forget my tool here, but that's fine, I can use my finger. So I'll be placing my finger and landscape, and upwards this way, on your jaw. Okay, and I'm going to be giving my finger, not your jaw, my finger a tap, and then I'll be looking for the jaw, just a slightly sort of jaw jerk reflex. Okay, so all I need from you is to just stand there, look amazing. And you've been doing that since the start, so I'm sure you can do it. Okay, so relax the jaw for me. Okay, that's wonderful. We're placing my finger on the jaw. I'm going to tap this 2 times, okay. Okay, that's wonderful. Yeah, we saw the slight jaw reflex. Yeah, I was gentle. I don't want to cause you any pain, of course, so I know how hard to hit it and how hard not to hit it. Yeah. Okay, I'm going to just come to the side here for the second and final test, okay. So again, you can keep your jaw nice and relaxed for me. That's wonderful. Okay, we're going to go for a second tap here. And there we go, fantastic. Well done. Alright, I'm going to put my big thingy away now. Okay, so that's fine. Yeah, we're getting into the Halloween spirit here with the pumpkin. I think it's a pumpkin anyway. It's orange and yellow, and there's a green thing on the top, so it's the same as a pumpkin. Right, enough about my pumpkin now. So that's fine. Yep, no problems there. We're going to move on to the trigeminal nerve sensations. Okay, so we have a cotton bud or Q-tip or cotton wool-tipped applicator. If you're posh, you're not. Okay. And I'll be brushing this across the face. I'm going to first of all show you what it feels like. Okay, so I'll brush it against your forehead. Okay. Right, so it's nice and soft, yeah. So afterwards I'll be using a pair of tweezers. I find tweezers are probably the best thing to use, so I do tend to use these. These are relatively sharp compared to the soft Q-tip. Okay, and I'll show you what the sharp feels like. Okay, so I know I say sharp, but it's not going to break the skin or anything like that. I mean, I could if I wanted to, but I don't want to do that with you. Maybe some other patients. Okay, this is what it feels like. Very, very gentle. Okay, don't have to be worried. Okay, there we go. Okay. See, nothing to worry about. You fully trust me. I'm a very good doctor after all, aren't I? Thank you. Right, so I'm going to be brushing this 6 times across on the face. Okay, so on the forehead, on the cheek and on the chin, on both sides. I want you to tell me, does it feel more or less the same on one side versus the other? Okay, simple as that. Alright, here we go. Okay, now the other side. Okay, didn't it feel more or less the same on both sides? It felt soft each time. Okay, so we move on to the tweezers then, since you're doing so well. And again, 6 times across the face, I'll ask you, does it feel more or less the same? And then I'll ask you, does it feel sharp each time? Okay, you got this. You got this. Here we go. Don't worry, be very gentle, okay? Here we go. Good. I appreciate your trust. Did the sharp object feel more or less the same on both sides? And did it feel sharp relative to the Q-tip each time? Okay, wonderful. Right, I'm going to jot that down then. Okay, I've got a few more minutes to go, so it's going really well. Okay, I'm very happy with how things are going. Alright, I think I'm going to skip to the fundoscopy now. It's not fun, but it's just called a fundoscopy. You can look it up. It's a real test. It's not me making it up. Yeah. It's a real test. Yeah. Right. So I'm going to be looking into your eyes. Okay. So first of all, inspecting the front surface of the eye. Okay. Did I make my note last time? Let me just see. I do tend to forget. No, that's fine. Yeah. Any double vision at all recently? It's worth noting that down actually. That's fine. Okay, so we're looking for the red eye reflex. Okay, so I've got to check my setting. There we go. So I'm going to be shining a bright light into your left eye, okay, for about 2 seconds. And I'm going to be doing that in 3, 2, 1, now. And there we go, we're done, well done. And the same again, but this time to the right eye, okay? So I'm going to be shining a bright light into your right eye in 3, 2, 1, now. And there we go, well done, fantastic. Good, okay, so that's the first of 2 or 3 checks I need to do with the eyes, okay? That's fine, no issues there. Okay, just going to use some magnification now, okay? Okay, so I'm going to be shining the bright light again into your left eye in 3, 2, 1 now. Okay, we're done. And into your right eye in 3, 2, 1 now. Well done, we're done. Fantastic. Good. That's wonderful. Okay, I'm going to have to dim the lights in a moment, okay, to do the third and final check. I'm going to be assessing the optic disc and the vessels, okay? If I need to put some eye drops in, is that okay? Being very brave, okay, I really appreciate it, okay, I understand how difficult it can be, alright, so really properly proud of you. Alright, I'm going to do 2 drops in each eye, okay, so just if you put your chin back ever so slightly for me, that is wonderful, thank you so much. Perfect, absolutely perfect, okay, how does that feel? Doesn't sting or anything like that, does it? No. No, when I say eye drops, people kind of freak out, like, oh no, if it starts bubbling up or fizzing. No, it doesn't do that. Okay, so blink a few times, okay? The idea is we are dilating the pupils. Yeah, blink a few more times for me. Yeah, that's fantastic. Okay, I'm going to be dimming the lights, okay, so we get nice and cozy and romantic. So this will be the last check actually of the cranial nerve, okay? We skipped a few checks because I wasn't very happy with the previous test, so sometimes not always a need to go through every single one, okay? So you're doing amazingly well, okay? So let me shine the bright light into your left eye, 3, 2, 1 now. Okay, well done. And into the right in 3, 2, 1 now. And we're done, fantastic. Good. Right, I'm going to pop my light back on, but that is the end of the cranial nerve exam. Okay, no issues observed whatsoever, everything is fantastic. I'm going to let you go now and make a few more notes, so it was lovely to see you. Take good care.